Welcome. I am Dr. Thomas Gerber, one of the Associate Editors of Mayo Clinic Proceedings. In this recording, I will focus on the articles that our Editor-in-Chief, Dr. William Lanier, has chosen to be featured on the cover of the February 2013 print journal. This month's Editor's Choice is the original article entitled Stratifying Risk of Urinary Tract Malignant Tumors in Patients with Asymptomatic Microscopic Hematuria by Dr. Ronald Liu from Southern California Permanente Medical Group in Los Angeles, California, and colleagues from several other national healthcare institutions. The authors performed a study to identify patients who could safely avoid unnecessary radiation and instrumentation after the detection of microscopic hematuria. They find that a considerable proportion of patients could avoid extensive evaluations with the use of a hematuria risk index that includes gross hematuria, age 50 years or older, smoking, male sex, and more than 25 red blood cells per high-power field on a recent urine analysis. A video interview by Dr. Ronald Liu can be viewed on the homepage of Mayo Clinic Proceedings. The accompanying editorial entitled Proper Evaluation of Asymptomatic Microscopic Hematuria in the Era of Evidence-Based Medicine, Progress is Being Made, was authored by Dr. Gary Schwartz from Mayo Clinic in Rochester, Minnesota, who is also our section editor for genitourinary diseases. Dr. Schwartz feels that the study by Liu and colleagues adds to a hopefully growing series of studies that will help fulfill the promise of individualized medicine for the evaluation of patients with asymptomatic microhematuria. One of this month's highlights is the original article entitled 12-month frequency of drug metabolizing enzyme and transporter-based drug-drug interaction potential in patients receiving oral enzyme-targeted kinase inhibitor antineoplastic agents by Dr. Stephen Bowling and colleagues from the Medco Research Institute in Bethesda, Maryland. Studying a pharmacy claims database, the authors found that simultaneous prescription of drugs that induce or inhibit metabolic pathways used by enzyme-targeted kinase inhibitor oral antineoplastic drugs is high. Frequently, oncologists prescribe the oral antineoplastic drugs and non-oncologists the drugs that create the interaction. The accompanying editorial entitled Preventing Adverse Drug-Drug Interactions, A Need for Improved Data and Logistics was authored by Drs. Michael Seminario and Mark Ratain from the University of Chicago in Chicago, Illinois. The authors suggest that computer systems should be able to recommend appropriate treatments while minimizing risk for potential drug-drug interactions. However, for this to happen, the producers of drug-drug interaction software and databases need to ensure that their products are accurate and that they provide useful information to the prescriber. In doing so, the producers should go well beyond a catalog of potential drug-drug interactions and must focus on clinically important interactions, ideally supported by validated data. The other highlight in this month's issue is the original article entitled Safety of Clopidogrel in Hip Fracture Surgery by Dr. Molly Feely and colleagues from Mayo Clinic in Rochester, Minnesota. In a small study of 40 patients and 80 controls, the authors found no evidence that prompt surgical treatment of hip fracture in patients taking clopidogrel compromises perioperative outcomes as measured by perioperative bleeding, mortality, or perioperative thrombotic events. A video interview with Dr. Feely can be viewed on the homepage of Mayo Clinic Proceedings. The review article entitled Topical Analgesics in the Management of Acute and Chronic Pain was authored by Dr. Charles Argoff from Albany Medical College in Albany, New York. Based on a comprehensive literature review, the author concludes that topical analgesic therapy using non-steroidal anti-inflammatory drugs or lidocaine has an important place in the management of acute and chronic pain conditions. The special article entitled Care Coordination for Patients with Complex Health Profiles in Inpatient and Outpatient Settings was authored by Dr. Leonard Berry from Texas A&M University in College Station, Texas, and colleagues from Gunderson Health in La Crosse, Wisconsin. With the major changes in healthcare provision and reimbursement mechanisms that are on the horizon in mind, the authors discuss the Integrated Care Coordination Program that is in place at Wisconsin-based Gunderson Health since 2003. This program has been associated with reduced hospital stays, lower costs for inpatients, less use of inpatient services, and increased patient satisfaction. A video interview can be viewed on the homepage of Mayo Clinic Proceedings. The original article entitled Increasing Incidence of Nutritional Rickets, a Population-Based Study in Olmsted County, Minnesota, was authored by Dr. Tom Thatcher from Mayo Clinic in Rochester, Minnesota, and colleagues from Mayo Clinic and from Olmsted Medical Center, also in Rochester. The authors find that nutritional rickets remain rare, but its incidence has dramatically increased since the year 2000. Not all cases of rickets can be attributed to vitamin D deficiency. A video interview with Dr. Thatcher can be viewed on the homepage of Mayo Clinic Proceedings. Please remember that authors or co-authors of 4 of the articles we have discussed, Drs. Jacobson, Berry, Thatcher, and Feely, have provided video interviews. These interviews can be found on the homepage of Mayo Clinic Proceedings at www.mayoclinicproceedings.org in the lower right-hand corner. There, you will also find another video interview related to an article from our February issue, Metabolic Syndrome as a Risk Factor for Barrett Esophagus, a population-based case control study. Many more videos, indexed by journal issues and by themes, are available on our YouTube channel at www.youtube.com/Mayo Proceedings. Also on the website, our series entitled Meet the Mayo Clinic Proceedings Editorial Board and Staff this month features Kimberly Sankey, who has been with Mayo Clinic Proceedings since 2002, currently as an editorial processing specialist. As you know, you will also find on our homepage additional content that is not available in the print journal, such as extra residence clinics articles, medical images, stamp vignettes, and other materials. Please follow us on Twitter at www.twitter.com/Mayo Proceedings to learn about online first publications in Mayo Clinic Proceedings and newsworthy developments related to our journal. Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, the entire editorial board, and I sincerely hope that you will enjoy these and the other outstanding articles in the February 2013 issue of our journal. We are sincerely grateful for your interest in and continued loyalty to Mayo Clinic Proceedings. As a preview, the March 2013 issue of Mayo Clinic Proceedings will contain articles on the medical marriage, a national survey of spouses and partners of U.S. physicians, atrial fibrillation in the 21st century, risk factors and prevention strategies, and Mary Todd Lincoln's fatal pernicious anemia. Our March issue will go live on our website on March 1st, 2013. See you then.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.